Hey, Aloha gang, Dr. Russ Rosen here. Well, I think we can agree it's been a couple of wild days and we're in some unprecedented times. Clearly, we've never seen anything like this, and it just seems like a perfect storm, with the virus, the ever changing information, the misinformation, the continual fear, the whole media routine that's going on, how incredibly unprepared most of the countries are in dealing with such a thing and not having the provisions that they need. These are some wild times. So, as far as I'm concerned, this is a time for us to step up as thought leaders in our community. And there's three specific things that I'm going to recommend that we do to help our patients, our communities, and ourselves. I think we need to let our patients know what we're doing to help them avoid contact. Number two, I think we need to really help them understand how important it is right now to get healthy and stay healthy, to build their immune system and what they can do about that. And number three, for you to have a preparedness type of plan. So let's dive into these. So yes, do we want to avoid contact? Absolutely. Do we want to the social distancing? Absolutely. They're getting plenty of that information out there in the world right now, but right now, as far as the hospitals being able to handle the load and all that kind of thing, man, they're going to be really, really busy doing the best they can trying to help save lives. They're not going to be out there helping people understand what they need to do to be healthy. They're going to just be doing triage and helping people, again, stay alive. Thank God for what they do. So let your patients know what you're doing inside of your office. And so I'm forwarding a whole bunch of different things that I think might be valuable, and I'll continue to put more things in the link as I get them. This is something that one of my doctors came up with after a discussion that we had. I'll forward that to you. And, he's just saying with the ever-changing environment of the COVID-19, here's what we're doing to keep you safe and in this office and things that you can do. And he's talking about in his office, we're disinfecting doorknobs, switches, faucets throughout the day. We're disinfecting the adjusting tables a number of times of the day. Asking every patient to wash their hands when they come in and use sanitizer. They're changing the face paper, obviously, as they always do. Asking if you're ill, not to be coming in. If you've traveled in a high-risk area, quarantine yourself, don't come in. And that he's making special arrangements and appointment times for patients who are immunocompromised, doing chemotherapy, HIV positive in the elderly population. So I think it's really important to let them know, yes, we want to avoid contact as much as possible. Here's what we're doing on our office to protect you. So whatever it is that you think you should be doing, I think that you want to have that. And also the second part two, is what can you do? What can you do to get healthy and stay healthy and build your immune system? Now, personally, I like to open that conversation by just saying, look, we all know, you've been at work, there's 50 people. Someone comes in sick with a regular flu, right? And some people get sick and some don't. Some people get a little bit sick and some people get very sick. Some people die. What's the one difference between all these different people? It's their immune system. It's their health. It's who they are going into the contact with this. Look, odds are at some point in the next year or two, we're all going to come in contact with it. I mean, those are pretty much the odds. The question is, who will you be when you come in contact with it? What can you do to bolster your immune system right now? So the second part of this is, what can you do? So the best way to take control of the situation is to keep yourself as healthy as possible. Here's a list of things you can do to stay healthy. So obviously, it's all this stuff. It's all the basic stuff that we all know. Eat well. Plenty of rest. Don't let yourself get run down. Stay hydrated. Continue to exercise. Don't become hysterical or driven by fear. Listen, this is such an important piece of the puzzle. I'm also forwarding a video that Dr. Angus Pike did on a particular study that's really a mind-boggling study on stress and the immune system, specifically with getting different viruses, including a corona-type virus, not this one, blown up your nose, and who got sick and who didn't, and its relationship with stress. If you've ever studied Norman Cousins, the man who laughed himself back to health in 1964, he got ankylosing spondylitis. He had a 1 in 500 chance of getting better. And he's a guy who laughed himself back to health. There's been tons of research because of that, of what he did, of just looking at, when we're stressed, what happens to the immune system? It goes down. When we're joyous and happy, what happens to our immune system? Again, if you do anything along the lines of, QNRT or NET or EFT, anything you can do to help people deal with this stress. A lot of us are under tremendous stress right now. Look, this is the first time I have ever been in the at-risk group. Over 55. I'm hitting 60 in a couple of months here. I've got family members that are elderly and obese and on medication. Most of us do. We know someone, we have family members. These can be really scary times. So, with this kind of stress, what can we best do to help support our patients? No question getting adjusted. No question having the right nutrients. Yoga, meditation, EFT. If you're not familiar with that, just Google emotional freedom technique. There's so many different things that we can do. Okay, so wash your hands regularly. Obviously, don't be touching your face. Oh boy. Stay away from large crowds. Stay away from obviously sick people. Get adjusted. Get your nervous system working right. We've got another study that the flu pandemic, I think it was 1918, in the study on chiropractic, which is really tremendous stuff. So you want to take a look at that and share it with your patients. And then obviously he talks about specific supplements that he recommends. If you're doing things like CRA or NRT, you're using specific kinds of nutrients for specific things, man, now's the time to help people out. You can obviously, if you're using standard process or Emerson or systemic formulas, they have all kinds of different programs for this. This is the time to become a thought leader. This is the time to step up and help these people out. I'm also forwarding, we've sent this out before, but it's the Bill Esteb poster, which I think is really, really a great poster. I'm going to be sending you a letter from the California Chiropractic Association, which I think is a really good letter to get out to our patients, and a few videos that they recommended. Some other documents with some research. There's one link that we have in there that just has tons and tons of really good research on immune system, getting adjusted, all that kind of stuff. If you have other great materials, send them to me, and I'll add them to the file. So how can we do that? How can we help our patients understand how to bolster their immune systems right now? I have several offices that I'm coaching that are doing webinars for the patients right now. Some are still doing talks in areas that really don't have any outbreaks yet, but certainly you could be doing a webinar on this subject. You can be doing a Facebook Live or chat or any of those kinds of different social media type of things you can do. I have one office, the Dr. Brennan's. They do amazing chiropractic. They do QNRT, which is amazing as far as dealing with the emotional stress and also specific things in relationship to viruses and helping the brain and body better deal with that. They also use acupuncture. They use nutrition. And so they're just really, giving their whole wrap of what they do and helping their patients understand things that they can do. I have another doctor who's doing a whole webinar, webinar right now specifically on the immune system and some of the things that he's amazing at. This is a great time. If you're not a specialist when it comes to nutrition, it's a great time to find somebody who is. Probably you see somebody, a naturopath, somebody doing functional medicine, something along those lines. I personally coach chiropractors, naturopaths, osteopaths, holistic medical doctors, like whoever wants to help people get healthy and stay healthy. It's such a great time to work together. Again, our brothers and sisters out there on the front lines in the hospitals, that's not their job. That's not what they're going to do. They're doing disease care. They're helping people stay alive. Thank God for them. But what we're doing is healthcare. And we're going to help people do their best to get healthy and stay healthy by building their immune system and staying healthy. And if they are going to get contracting the virus, that they want to do it from the best, strongest place they possibly can. So as a thought leader, what are you going to be doing to help your patients get this information? So again, big fan of co-sponsoring talks with these people, giving everybody an opportunity to get an evaluation with them and to get an evaluation with you. All right, and what's the third thing that we have to do? We got to think about preparedness. We've got to start to think things through. What are we going to do if? Now, I'm not saying coming from a place of fear. I'm coming from a place of, look, my experience is when I'm in fear, I rarely make good choices. So before things happen, in case they happen, let's start to think this stuff through. What are you going to do if your staff gets sick? Any kind of sick, just regular flu or coronavirus. What are you going to do? What are you going to do if you get sick? What are you going to do if your area gets quarantined for a while and people are not allowed to come in? Do you have access to your patient's files? Are you going to be able to keep in communication with them to continue to help them through this scary time? Will you have ways that they'll know to, through Facebook chat or through email? Personally, I think social media is a really good thing to be able to do, to be able to, help these people through these scary times. What is your plan? How are you planning on being able to support these people? What do you plan on doing if you have this time off? Vacation? Binge watch Dexter? What do we plan on doing if we are sequestered, if we are quarantined? Are you going to be working on your craft? Are you going to be working on your skill sets? What are you going to be doing to stay in front of these people and helping them so when they're not quarantined and they do recognize, man, it's time, I need to get healthy, I need to bolster my immune system, I need to make sure that I'm doing all the things that I can do for myself and for my family. What are you doing to make sure that when they do come back that they are going to be seeing you? So again, listen, as with all times, whenever there's a crisis, think back to the 2008 financial crash. Lots of offices went under, and then lots of offices did better than ever. The cream will rise to the top. Who will you be? What will you do so that after this contraction, you are one who steps up, helps people out, and thrives like never before? So these are just some things that I'm having conversations with my docs about. Man, this is ever changing, right? I mean, by the minute, things are going absolutely wild and crazy. For sure, I think that one of the best things that we can do is help deal with the fear. Is it scary? Yes. Are people going to die from this? Yes. Is fear going to help? No. We know what fear does to the stress hormones. We know what it does to the immune system. We know what it does to people making reasonable and logical decisions. So, as healthcare providers, what are the things we're going to do? So again, I'm going to recommend that you hand out some kind of flyer, send out a letter, make sure they're clear about what you're doing so that they're not going to be exposed to it in your office. What you're going to recommend that they do to get healthier and to bolster their immune system, and for you and your team to have a preparedness plan. What are we going to do if? So, man, I hope that helps. I know that these are really tricky times, and this is when the cream rises to the top. This is where we really get to step up and help out our communities. I hope it helps. I'll keep putting more information I get and forwarding other things to you that I think might be of help. We're in it together. I'm here to help in any way I possibly can. Flip me an email. As always, much love and aloha. Bye, gang.